Hi, I'm Julia, and welcome to Fort Healthcare's Bariatric Weight Loss Surgery Program, a comprehensive, safe, and effective approach designed for those with 100 pounds or more to lose to take back their health and their life. Let's learn more now.
I tried many different diets, probably got about 40 different diet books. I was in TOPS, I was in Weight Watchers, I did the carbohydrate diet, and I went down a little and up more and down a little, and nothing really worked for me to stick to it. I knew it before I even had it done that was the one for me. So.
I went from a size 60 pants to a size 50. I'd recommend it to anybody. I feel so much better. I think it's just, I wish I'd have done it years ago.
It'll be a year tomorrow since I had my surgery, and depending on the scale that I go by, either here in the clinic or at home, between 65 and 70 pounds.
Great.
And I feel great. I'm very glad that I did it. I would do it again in a heartbeat.
Pretty much any diet that's out there, any books, people that are heavy pretty much try anything that anybody says. My life has changed tremendously. I'm active. My daughter's not embarrassed of me anymore. It's been phenomenal. I wouldn't change it for anything. And I'm not embarrassed to tell people that I had it done, because if I can save somebody else's life like it has saved mine, more power to them.
I'm sitting with Patrice, and Patrice is the bariatric coordinator. Tell us about the program.
First thing a patient has to do is to attend one of our monthly informational sessions run by Dr. Erickson and myself. We will then set a patient up for a consult to come in and meet with us to determine if they qualify for the program. They will meet with a dietitian and exercise physiologist, and then we're ready to set up surgery dates. Once they have their surgery, they'll come back for monthly follow-up appointments to meet with Dr. Erickson, and then I also offer monthly support groups for our patients so that we can meet informally and just talk about any issues the patient has. Main thing a patient has to remember is that the lap band is only a tool, and that it can work very effectively, but they have to be willing to make lifestyle changes for it to be very effective.
Fort Healthcare has performed about 150 successful lap band procedures in the past 5 years. This is Dr. Erickson. He's the surgeon for this procedure. Dr. Erickson, tell us about lap band.
I'd be happy to. This is a really cool tool. There are a lot of ways that you can imagine that we help people lose weight surgically. This is probably the least invasive one. And what this involves is essentially a balloon on the inside of this plastic tube that we can snap around the stomach. This is a model of the stomach, almost like a belt. So laparoscopically, we put this into the abdominal cavity through small incisions, and we snap this into place. What this does is creates a belt with essentially a balloon that's segmented on the inside. We can attach this to a little port, and this is what a port looks like. We use these for chemotherapy and other things. This gets implanted in the left upper abdomen. We can access this port with a special needle, and we can tighten or loosen the band if we need to. The way this works is that it creates about a half-cup pouch up above the band, and this becomes essentially your functional stomach. So when you eat a meal, it'll take about 3/4 of a cup or a cup to fill this up, then it'll slowly empty through the band. The beauty of this is that it's completely adjustable for each person. So if we get you properly adjusted, we expect people to lose about 1.5 pounds to 2 pounds a week. They'll eat about 3/4 of a cup at meals, and if we combine this with some changes in their lifestyle, like exercise, people generally lose weight effectively. Our average person loses about 65 pounds in the first year and about half that the second year.
But the real key to successful long-term weight loss and better health is what you do after surgery. Nutrition and food selection are vital components to the success of bariatric surgery. Stephanie Nishik is a registered dietitian who's going to help us learn more about proper food choice. Hi, Stephanie.
Hi, Julia.
Tell us.
Well, as you say, being successful with bariatric surgery is going to require some lifestyle changes. And the dietitian's role is to educate our patients about eating healthy. We use the food guide pyramid to educate our patients, and of course we emphasize the importance of eating lots of fresh fruits and fresh vegetables, because those types of foods are naturally low in fat, high in fiber, help us feel good, and have lots of good vitamins and minerals.
Weight loss care, close to home care, that's your Fort Healthcare, one of the most progressive community health networks in Wisconsin. To learn more about the exciting weight loss program at Fort Healthcare, go to forthealthcare.com/bariatrics.